Samrakshan Diaries, Pre-eclampsia awareness for all.
Doctor, now I know that pre-eclampsia is life-threatening for both mother and the baby. Please tell me more about the complications of this condition.
Well, Radha, there are many complications for both mother and baby during pregnancy and after delivery. Complications for mother during pregnancy are related to liver, brain, lungs, blood, kidneys, and then there could be a combination of these problems or complications like combination of impaired liver function and low platelet count, which is called HELP syndrome. Complications for mother after delivery are heart disease, hypertension, cerebrovascular accidents, that is accidents related to the brain like brain hemorrhage. Now this is the timeline for cardiovascular risk in these mothers who have had preeclampsia during pregnancy. The short-term effects of preeclampsia after delivery on these mothers are hypertension, diabetes, deranged lipids in these mothers. Long-term effects are related to heart and the brain. These mothers are 5 times more likely to develop heart disease or stroke in subsequent 20 to 30 years after delivery. And 2 out of 3 women who develop preeclampsia in pregnancy die of heart disease. Complications for babies during pregnancy. These are intrauterine growth retardation, premature delivery, abruptio placentae, that is, there could be bleeding behind the placenta leading to fetal distress or fetal demise. Complications for babies born to these mothers who have had preeclampsia in pregnancy are obesity, hypertension, metabolic disorder, that is diabetes, and developmental delay, that is neurological deficit in these babies born to preeclamptic mothers.
Well, doctor, what are the symptoms I should be looking for?
There are many symptoms like swollen face, swollen hands and fingers, swollen feet and legs, but these symptoms are also present in a normal pregnancy. So other symptoms of concern are severe headache, visual disturbance, pain in the upper abdomen, more so on the right side, and decreased urine production.
Well, doctor, which mothers are at risk?
Very young mothers or older mothers more than 35 years, first pregnancy or IVF pregnancy are at risk of developing preeclampsia. Obese mothers are at risk. Mothers who have had diabetes before pregnancy or kidney disease or hypertension before pregnancy, they are at risk of developing preeclampsia. Also, if there is history of preeclampsia in the family or personal history of preeclampsia in the mother in previous pregnancy, these mothers are at risk of developing preeclampsia in this pregnancy as well. Other conditions like excessive weight gain during pregnancy, prolonged pregnancy, twin pregnancy, gestational diabetes, that is diabetes developing during pregnancy, or heavy babies or big babies which are called macrosomic babies. All these conditions, there is overload on the heart of the mother causing preeclampsia.
Thank you, doctor, for general awareness about preeclampsia. I am much wiser now than before.
Well, Radha, take care. Next time I will tell you how and when to screen for preeclampsia. And just to remind you, Samrakshan is a national program by Indian Radiological and Imaging Association to fight against perinatal mortality in India.